welcome back. Asante Sana for keeping it K24. As always, we do appreciate your company from 6 a.m. to 9 a.m. on weekdays. My name is Shiko Kaitani and welcome to another session of Health and Wellness. Now, this morning, we're actually drawing blue circles on your screen, and that's because World Diabetes Day is coming up. Not to be confused, by the way, with Diabetes Week. Now, World Diabetes Day is celebrated in a number of ways, from sporting events to lectures, including TV and radio programs to spread awareness. And that's why today in studio we do have one Dr. Saira Sokwala, who's an endocrinologist from MP Shah Hospital. We also do have Mary Mtawa, who is a patient. Last but not least, Betty Okere. We always love her on the show, nutritionist, here with us yet again. So ladies, how are we doing? Yeah. Good to see you again, Daktari. It's been a while. Yeah. And of course, Mary, karibu sana to the show. And Betty, welcome back.
My pleasure.
We have missed you. Let me start off with you, Dr. Saira. You know, when we talk about the theme being family and diabetes, what is really the importance of actually roping in and paying attention to our family in regards to people who are, you know, battling, if I can use that word, with diabetes?
So, diabetes is quite multifactorial.
Yeah.
Okay, it's quite like involving a lot of systems, a lot of challenges. From beginning, from the condition itself, the fact that you're supposed to change your lifestyles, you're supposed to be on several medication, you're supposed to, you know, fit in all these glucose testing, and you know, going for your follow-ups, and all these things in between your normal routine life. And so it's not a condition which can be managed alone. It's not a condition which, you know, it's only the patient and the condition and that's it. There's a lot of psychological, social impact to diabetes, economic impact, okay, to not only the patient but to all around them, especially the family. So the family is actually core in the management of this person living with diabetes. Again, the truth is, a person who has diabetes, by just having diabetes, your family is already at risk of having diabetes as well. So that aspect also comes in the aspect of prevention. So prevention for the rest of the family and also support and you know, for the best management of the patient to be able to support the patient into it.
Mary, if we can just rope you in and just to add on to what Daktari has said, when you are diagnosed with diabetes, did you see it affect your family?
Well, the very first day when I was diagnosed, it was a bombshell for me. I never expected it at that age. But going back from my background, my father, my grandmother, my grandfather had it, but it just came as a big shock to me.
Okay, because you didn't think you would get it.
Yes, at that age. I thought diabetic was for the old people.
And when you mean by that age, what age are we talking about?
I was 22.
22?
Yes.
Wow. So did you feel like that was like a death sentence to you?
In fact, it was like, I thought the next thing that I'm hearing, it's death. I'll just be on the casket the next day.
What was your perception of diabetes back then when you had?
I thought it was just for the old people, not for the young people. In my mind, I thought that diabetic is for the old people, the rich, you see, the kind of food that they are eating, the lifestyle. So I never thought it will affect me at that age. Yes.
Okay. Betty, listen to that. And I think there's a lot of people who actually have that mentality that Mary had before. That, by the way, I'm only in my 20s. I'm not going to get diabetes. It's something for the old and it's a rich man's disease. So take us back to the basics in terms of what types of diabetes we've got and who are really being affected by this.
Interestingly, thank you for that.
Yeah.
Interestingly, for Mary's case, usually when people get diabetes at such a young age, most people want to believe that maybe they're not type 2.
Yeah.
But as we came to realize later when we did several tests on her to just confirm, we realized that she's a type 2.
Wow.
So then it is to create the awareness and tell people, yes, even though type 2 diabetes can be found
Yeah.
in people who are older than 35 years old, you know, we expect it in 40 years, you know, you have some weight with you, it is a lifestyle related condition, your family history leads to it. It can also be found in younger people, and that's what I think the Kenyan population is not taking keen interest in. But as I go to the types, there's type 2 that I've tried to mention, and basically it's lifestyle based, there is hereditary aspects to it, and it's more of you have little insulin, what we call insufficient insulin, but you might also have cases of resistance to insulin, which is the biggest actually issue, or sometimes you have both. And then we have what is now becoming also very common, gestational diabetes, basically defined as diabetes in pregnancy, right? And that, we are seeing a lot of that, and I think as a hospital, MPH is doing a lot to try and screen when people go for the gyna clinics, so that you find it in time, right? And that's between the 22nd to the 28th week. In between there, you can screen for it. And if the mother is actually at risk, you come from a family that has high risk of diabetes, it's just good to keep checking. Your weight is a bit too much at the time of conception. You know, you start seeing the signs and symptoms of diabetes, excessive thirst, or frequent urination. You want to check for those things.
Right.
And then there is the type 1 diabetes, which is now an autoimmune condition. Really, they may not need to have any family history, but a child or a young adult can end up having type 1 diabetes. The difference is when you have type 1 diabetes, you actually cannot produce any insulin. And if you can't produce any insulin, then you have to be given insulin injections. However, across board for all the types of diabetes, they can all use insulin. So it's not a reserve for type 1 diabetes as most people think.
Okay. All right. And so let's rope in our audience at this particular point. Remember, if you've got any questions in regards to diabetes, this is the time to actually start sending them in. Talk to us through our social media platforms. If you prefer to call us, why don't you? We'd love to hear your voice, Kamakawa. Those numbers are going to be at the bottom of your screen. And so when we talk about diagnosing someone, Dr. Sarah, how do you go about diagnosing a patient?
So most of the times the patients, like if you're looking at type 2 diabetes, for example, they may not even know they have diabetes. So they come in most of the times for something else, and a routine test would reveal that their sugars are high, you know, a routine blood test. So if you look at diagnosis, it could happen in various ways, okay? So the first thing, like I said, is the patient brings themselves for something else, and you have done a test and it's showing that the sugar is high. Another circumstance is like in these screening camps, you know, medical camps, so someone has gone to be checked, they've just been found that their sugar is high. So what I'm trying to say is it could actually be completely asymptomatic without any symptoms, especially type 2 diabetes. Or there's another category, to just add to what Betty has said, is the other specific types of diabetes which could be caused, you know, by alcohol overuse or by diseases of the pancreas or some other hormonal problems. So when you look at diagnosis now, what tells you that this is diabetes? So the criteria is different when you're looking at pregnant women, which we now talk about the gestational diabetes or pregnancy-related diabetes, versus the non-pregnant individuals, whether it's adults or children. You know, diabetes now we are seeing it more and more in younger people. We have Mary with us, who initially was diagnosed in pregnancy, but then later on went on to develop type 2 diabetes, because about 50% of women after pregnancy related diabetes or gestational diabetes end up developing type 2 diabetes within 5 to 10 years of their diagnosis of gestational. So now the criteria that we are looking at for non-pregnant adults, specifically, we check their fasting sugars. Okay. So if your fasting sugar is more than 7, then it's a clear-cut diagnosis of diabetes, especially if it is done on 2 different occasions. Okay. There's this category of impaired fasting glucose, or what we used to call as pre-diabetes. Okay. It's nowadays the name has changed a bit. We call it dysglycemia or impaired. For more clarity, it's impaired fasting glucose. Okay. So that is when your fasting sugar is between 5.6 and 7.
Yeah. Oh, and let me stop you
Yeah.
there so that you can, people can actually get it. When you talk about fasting sugar, what does that mean?
That means about 6 to 8 hours of not having eaten anything.
Okay.
So the first thing in the morning, we tell patients when they've had their last meal at night, and they come first thing in the morning, and you check their sugar, or they can check it at home. Okay. So that sugar, if it is between, this is according to the American Diabetes Association guidelines and a couple of other international guidelines as well.
Right.
When you look at 5.6 to 7, then that is what you call as impaired fasting glucose. That puts individuals at very high risk of developing diabetes itself. Right. However, it is potentially reversible in certain cases, if the right management is done.
Right.
Then you've got the 2 hours after food readings, okay? And that we don't expect it to be more than 7.8. So if it is between 7.8 to 11, then that puts again at a pre-diabetes or impaired glucose tolerance range. Okay. Anything above 11 is diagnostic.
Oh, right. Yeah. And she's mentioned a little bit about your story and how you came to find out that you were diabetic. But tell us about what those symptoms were like for you before leading up to the hospital, because before that, were you feeling any type of way? Reason being, we really want to understand, okay, if I've got this kind of symptoms, or if Mary was feeling that way, I could as well, be diabetic, and I need to go for a checkup. So can you tell us anything about how you were feeling before you got your diagnosis?
I used to feel very tired.
Just exhausted.
Yes, exhausted.
Yeah, and this is not the pregnancy, just generally you were?
No, it was during the pregnancy.
Okay,
So I used to feel very tired, and most of the time I used to take a lot of water. So I did not know at first what was happening to my body. I thought it was because of the pregnancy thing, that I need a lot of water for the pregnancy, and because I'm too heavy for the pregnancy, that's why I feel very exhausted.
Okay, Mary, let me just stop you there for a second. I understand we've got Mohammed from Mandera. Good morning, Mohammed. Good morning. Hello?
Hello, yes.
Yes, Mohammed.
Yes.
Karibu sana. Yes, tuambie. Uko na swali? Uko na swali?
I'm always pre-diabetic.
Okay.
Whenever I check meals, I get pre-diabetic. I went to the doctors, they gave me metformin. I usually take metformin once a day.
Yeah.
Whenever I take, I get very weak. My diabetes is not that much high. Whenever I take meals, it reaches 9 millimoles per liter, 10, sometimes 10. So the doctor advised me at the first time to do an extra exercise and diet management. I did all of them, but still it remained pre-diabetic. So he recommended me Glucovage. Whenever I take the drug, I become very weak. I want the doctor to advise me whether I will going to continue the drug or what will I do.
Okay, thank you so much, Mohammed, for sharing your story with us. We'll address that in just a few. Dr. Saira, you've got that question, right? Aggie from Eldoret is on the line. Good morning.
Morning, Shiko.
Yes, good morning, Agnes.
I had a question for the doctors.
Yeah, yes.
My husband was diagnosed at 16, and we have 2 kids together. Every time I'm pregnant, I mention it to the doc, but I don't see them conducting any tests on the kids. So are the kids at risk of getting the same?
Oh, okay. Very good question.
Every single day, every morning and every evening.
All right. Thank you so much for that. We'll answer that as well. All right. Asante Sana. Mary, continue with your symptoms so that at least both Betty and Dr. can answer those 2 questions. Yes, continue.
So I was saying that I used to be feeling very tired and thirsty. Then I used to eat a lot of stuff.
Yeah.
When I take my breakfast, after an hour or 2, I feel like I have not eaten anything. So I keep on eating. And when I keep on eating, I feel I'm adding more weight.
Yeah.
So I did not understand my body because the thirsty, I used to take like 2 liters. Then in the evening, the urination was very frequent.
Yeah.
in the morning and in the evening. So it did not click on my mind that there's something wrong with me.
Yeah.
And when I went to the hospital or something like that, they told me everything is okay, everything is okay.
Everything's okay.
Yes.
Right.
Until when I lost the pregnancy, it's when I went for further tests.
I'm so sorry to hear that.
Yes,
And
it's when I went for further tests.
For further testing, that's when they found out.
Yes.
And you know, let me just rope you in, Betty and Daktari. We see a lot of women, pregnant women, are not actually going to see their doctor, but just going for scans alone. So as long as there's a heartbeat and as long as you can see, you know, through the scan that the baby is okay, you know, mothers will not bother to check whether at all their sugars are okay. You know, your message to ladies who are watching who are pregnant on, you know, not just going for a scan alone and leaving it at that. Because you never know, that could be the situation.
In fact, it's so important. It's so important. Nowadays, the recommendation is for universal.
Yeah.
For any woman who is pregnant, between 24 and 28 weeks of pregnancy, you need to go and get yourself checked for diabetes. And there's a test known as the oral glucose tolerance test, which is done when you go fasting.
Yeah.
Then you're given a glucose load, you take it, and then your sugar is checked 1 hour, 2 hours, and sometimes even up to 3 hours after. So my message to all pregnant women out there, all women, you know, anybody who is pregnant, you are pregnant at 24 weeks, you have to get this test done.
Okay.
Now, if you have got the symptoms, like what Mary has already told us,
Yeah.
increased urination, you know, increased thirst, weight, you know, loss, but you're excessively hungry, tired, get your sugars checked immediately.
Okay. Okay.
Don't wait till the 24 weeks.
All right. Mary, Paul Sana about that. That is so heartbreaking. But, you know, Betty, roping you in on what Aggie has just asked, the caller from Eldoret. She says her husband was diagnosed at a very young age. And she says whenever she takes her children for clinic, I mean, you know, there's no stress on checking their sugars. Are they at risk at this particular point?
What puts one at risk of diabetes? If you have family history, it will put you at risk. But remember, the husband was diagnosed at 16. Chances are this husband is a type 1 diabetic, and that is autoimmune. It's not really related to what the children will have or not have. But already, the children sitting, in adulthood, they might have the risk because the gene is there.
Right.
But as children, they actually don't have any risk. And I think maybe it's the people she's interacting with that are not telling her that.
The right
It's not automatic that because their father is diabetic, as children, they have to be diabetic. It would happen independent of whether their father was or not. Of course, they have a risk, but not at that age. Maybe she should stop worrying about it. The only thing I would advise Agnes to do is that she maintains a healthy lifestyle, because remember, diabetes is a family responsibility and something that the entire family has to look at.
Right.
So that how the father is eating, all the children and even her can eat that way, so that it's a healthy lifestyle pulled through the entire lifetime of these children.
Right.
So that in the event they become adults, they're not obese adults, they don't have issues with resistance, and then they don't put themselves at risk of diabetes. But as children, really there is nothing she needs to worry about.
Oh, okay, that's good. Thank you so much for that. Mohammed, on the other side, Dr. Saira, talks about how he gets extremely weak with the medication that he's taking. Is this common to see with diabetics, you know, pretty much with their routine? Is it a nutrition thing? What would you say about that?
I think, so Mohammed has what he knows already, and I'm impressed by the way he put the whole question. He knows that he has pre-diabetes, which is what we were discussing, you know. And not all patients with pre-diabetes need medication. That's one thing to know. According to you know, guideline recommendations, there are certain criteria of patients who you would put on medication. Like he said, he tried diet and exercise, it didn't work alone. That's why he was put on metformin. But usually the thing is, you have to look at the dose of the medication. Again, his diet, I hope he's not like overly restricting certain nutrients which could be necessary for maintaining his, you know, basically well-being.
Right.
So even the nutritional advice, it is preferable to seek advice from a registered dietitian or a registered nutritionist to be able to get the correct information.
All right. Okay, so with that, I understand we've got another caller. Do we still have Njoki on the line? Hello?
Hello.
Good morning, Njoki.
Good morning to you.
Yes, Karibu Sana, do you have a question or a comment?
I have a question.
Yes.
my mother has been diagnosed with diabetes, and at this time, the fingers are really swollen, and sometimes she cannot even hold a cup. What might be the problem?
Okay. Thank you so much for that. We'll definitely be answering you in just a second. Thank you. Okay. Joshua from Kirinyaga, good morning.
Morning, Shiko.
Yes.
My question to our experts is a general one.
Yeah.
I want to ask, why is it that human beings have become so weak and to a point whereby our body have become susceptible to infections and to changes that are occasioned by even basic foods that are otherwise supposed to nurture the human body? And this is something that we don't see happening that much in the other animals within the general human kingdom. I mean, why would my body be unable to cope with the nurture that you get from food, like sugary foods that in some cases cause diabetes and all that? What's not happening? Is it that medicine has not been able really to understand the human body itself?
Okay, thank you for that, Joshua. Okay, Geoffrey is on the line. Good morning, Geoffrey. Hello, Geoffrey. Okay, it seems like we've lost Geoffrey. But now let's get back to what Njoki was actually talking about. And this is where I really wanted to bring up complications with diabetes and what really does make diabetes so deadly at the end of the day. Because yes, we understand it's not a death sentence, because if it's managed well, you can have a long life and healthy life. But what makes it extremely deadly and the complications that come with diabetes? Because you can hear her mom actually gets swollen fingers. And she was diagnosed with diabetes. So let's talk a little bit about her case and some of the complications that arise with that.
Yeah, so so what she said is the swollen fingers, right? When she's holding something.
Yeah.
Okay, I can't directly point to a particular complication that could be happening causing the swollen fingers. You'd have to do a lot more, assessment and evaluation to know what exactly that is. It could be a lot of things. Because you also have to rule out joint diseases themselves or things like nerve impairment, because diabetes can affect the nerves, it can affect the blood flow. So if you look at the complications of diabetes, we divide them into acute complications and chronic complications.
Okay.
So first thing to understand is this is not to scare people out there. People can lead an extremely normal life, free of complications when you have diabetes if it is well managed and taken care of in the right kind of setting, okay? But we all know that it is a condition which can lead to complications. So you look at the acute complications, you're looking at things which happen suddenly, like patients with type 1 diabetes, especially those who don't have insulin in their body, can present for the first time. 1 in 4 patients actually present for the first time in what you call as ketoacidosis, which is quite can be quite a devastating condition if not handled correctly.
Okay.
Or even people with type 2 diabetes, especially we see in the elderly who've got infections, who've got dehydration, they can also come with a condition known as hyperosmolar hyperglycemic state, which is similar to the diabetic ketoacidosis in people with type 1 or insulin deficient. Okay, you could even have extremely low sugars, and that's even more deadly than having higher sugars, because that can reduce blood flow. I mean blood glucose to the brain, and that can, the brain depends only on glucose for energy. So that could be dangerous, okay? So these are the acute complications. Now the more long-term complications, which people don't seem to, be worried about, because they set in pretty slowly, pretty gradually, and most of the times without any symptoms.
Okay.
So these include conditions which could affect the big blood vessels of your body and the small blood vessel.
Okay.
If you look at the big blood vessels, you could have conditions like strokes or heart attacks, decreased blood flow to the leg.
Right.
One foot or leg or part of it, one limb or part of it actually is lost to diabetes every 30 seconds.
Isn't that, yes.
So from whatever I've spoken, a lot of legs have already gone.
Right.
To diabetes.
Yeah.
So that is the truth. So that's one of the other complications, diabetic foot and diabetic like amputations and stuff. Then the small vessel complications, which are the more gradual onset ones. Things like nerve damage, so neuropathy, patients will be having numbness, tingling, burning in the hands, feet, affecting the motor nerves, so the weakness of the muscles, or affecting, you know, your autonomic, what you call as autonomic nerves, which you don't really feel about, affecting the heart rate, the blood pressures, your issues like with sexual function, erectile dysfunction, especially in men. Even in females, you could still get, you know, sexual problems. Again, the other part in the same category is kidney damage. Diabetes is one of the leading causes of kidney damage. Actually, most dialysis units, the #1 diagnosis is diabetes, actually. So kidney failure, and then the eye. So retinopathy, so damage to the eyes and the small blood vessels supporting the eyes.
All right, so thank you so much for that. What we're going to do is take a short commercial break, but then when we get back, there's definitely more to talk about in regards to diabetes care and management. We really do want to emphasize why it is so important to get those sugars checked. And as you can see, we've got so many complications that are tied to diabetes. You've heard it from Dr. yourself. But when we get back, Betty is going to take lead as we talk a little bit about nutrition. Keep it K24.